I did take opportunity. So, Chairperson, then there's only one question still.
Submit such in writing, the MEC would be able to respond to you.
I will definitely do so, Chair.
Thank you so
Chair,
much.
then there's only one outstanding matter in terms of specifically COVID, and it relates to corruption and the financial, can I say, ability to implement some of these monies that has been allocated to Newcastle, as well as there was 20 million allocated to them in terms of the slides the Premier gave. The Newcastle municipality's UIF went from 38.6 million to 918 million in 1 year. How are they going to stop this municipality to waste that 20 million as well? Then I'll pause there, Chair, and reserve my questions and put it in writing to the MEC. Thank you.
Yeah, let's proceed in that fashion. Can I then ask Honorable Hadebe to ask the questions that you want to put before the KZN Provincial Administration?
Thank you, Honorable Chairperson. And let me take this opportunity, Honorable Chair, and welcome the delegation from KZN. Chair, I must appreciate the presence of the Premier and say that he's the third Premier to heed the call and saw it fit and necessary to appear before the committee. Some, however, have not been able to honor such a request from the Portfolio Committee. So we truly appreciate and welcome his presence before the committee. Chair, currently the figures as indicated on the presentation indicates that there are 10,470 active cases with 2,152 deaths. However, what is frustrating is to note that out of the 10,470 active cases, only 159 are in quarantine sites and 1,049 admitted in hospital, both private and public. The report therefore indicates or paints the picture that 9,421 are in self-isolation. Now, I want to get an understanding from the Honorable Premier. Does it mean that KZN does not have challenge when it comes to issues of those that are infected having a suitable and adequate place to self-isolate, given the nature and the demographics and the geographics of the KZN, where you'll have rural areas? It's a worrying factor, Chair, especially if you take into account that for us to be able to lower the spread and fight the spread of infection, one need to do much in terms of isolation and quarantine. So if we get a report that paints the picture of 90% of positive cases, all of them are in self-isolation, it's really an area for concern, Chair. So I would want to get an indication from the Premier. Is this an indication that KZN does not have issues and challenges when it comes to stigmatization of the COVID-19 positive patients? We have seen and heard in other provinces that there's issue of stigmatization. As such, patients tend to run away from quarantine facilities. So is this the case when it comes to KZN? I'm raising this because Gauteng, KZN, and Western Cape are the leading provinces when it comes to the infection. So the Premier will do us a great deal if he can expand on this matter. The report, Chair, further indicates that 2.9 billion has currently been spent on COVID-related goods and services. And out of that, 925 million was spent on municipalities. I'd like to get a sense from the Premier as to how many SMMEs have benefited in this 2.9 billion. I'm raising this question because it is in our interest and it's our quest to ensure that we achieve the radical socio-economic transformation, and not everything that is black is associated with corruption. So in us pushing for this radical socio-economic transformation, it shouldn't be marred with corruption and allegations of maladministration. Which brings me to my next question, to say the Premier, will he be in the position to indicate to us thus far, as per the National Treasury regulation, that all procurement of goods and services ought to have been reported to relevant Treasury within 30 days after such transaction have taken place, that in their assessment of those reports that have been submitted to National Treasury on a regular basis, there are no incidents that seek to suggest that there has been attempts of price inflation, corruption, and maladministrating, so that when we advocate for the radical socio-economic transformation, we root out corruption as and when it raises its ugly head. We don't have to wait for SIU to do what we ought to have been done as a public representative, entrusted with responsibility of accountability and oversight. So if we can get the sense thus far, the report submitted to a relevant provincial treasury, how many cases of perceived allegation, inflation of prices in relation to goods and services that are acquired thus far? Thank you, Honorable Chairperson. Let me pause there for now.
Thank you so much, Honorable Hadebe. Honorable Kaiser.
No, thank you very much, Chair, for the opportunity to speak. Greetings to you all, greetings to the Premier and honorable members of the committee. I have a few questions, Chair, very, very briefly. I've heard the Premier talking about the traditional leadership in relations to the public awareness campaigns as is pertaining to the COVID-19. I want to raise a question in terms of what similar engagements has he made in terms of the religious leaders, and what joint action has he taken in this regard in terms of ensuring that rural communities, as he has explained to us, that he was working hand in glove with the traditional leaders. What joint engagement has he embarked on in terms of the religious leaders? The other question, it pertains to human settlements, Chair. With 670 informal settlements in KwaZulu-Natal, and with 222,000 households who live in informal settlements, informal conditions around eThekwini, and given the fact that there is a suffering of high rates of fire, natural disasters, and crime, more than formal parts of the communities there. What dedensification measures did the province embark on in the informal settlements, and what economic considerations have they embarked on to ensure that people still lead their lives while ensuring that they are safe? And lastly, Chair, on the informal settlement, what developmental programs are there in the province to eradicate informal settlements, given the worrying numbers that I have mentioned here, Chair? The other one relates to health. What emphasis has the Provincial Department of Health put to reduce levels of stigma and misconception of the disease of those who are infected with COVID-19? As you know that there is stigma attached to communities that do not necessarily have the knowledge about the disease. And I was interested in the discrepancies around education, Chair. And I'm happy that the Premier has brought about the SIU in terms of the 21,900 digital thermometers procured by digital by KZN Department of Education. If the Premier can just explain for us in detail in terms of what occurred and who are the suppliers and so forth with regards to that. Thank you very much. Those were my questions, Mr. Chair.
Thank you so much, Honorable Kaiser. Can I hand over to Honorable Direko?
Thank you, Chairperson. I won't be able to switch on my video because we are having a load shedding where I am now. Chair, my first question, let me also acknowledge the presentation that has been made by the Premier. Chair, my first question is that not so long ago, a grade 7 learner was raped after being sent back home to fetch her mask that she had forgotten at home. So I would like to know what measures does the Department of Education have in place to avoid such an unfortunate situation from repeating itself? Currently, how do they deal with a situation where a learner forgets their mask, learners forget their mask at home, especially in the rural areas where learners will have to walk a very long distance to fetch their mask? Secondly, Chair, lockdown has affected municipality badly, especially in terms of revenue collection. Currently, revenue collection in most of our municipalities is very low. And I would like to know what is very low and it will take municipality a very long time to recover. So is there any post-COVID provincial government plan to assist municipalities in this regard? The third one, Chair, on COVID expenditures, I would like to know how many quarantine sites and homeless shelters that did the KZN province have, and how much did they spend on those facilities? And also on the COVID expenditures, have they followed the Treasury regulations? The last one, Chair, is on the backlog of water, access to water and sanitation in schools. I would like to know if they do have backlog in the province, and if they do, what is their plan in order to address that situation? Thank you so much, Chair.
Thank you so much, Honorable Direko. Can I hand over to Honorable Gumza? Honorable Gumza. Honorable Gumza. In his absence, maybe I should start. One will start by noting the province being relatively on top of your COVID-19 operations. And we are aware that there are rooms for improvement to that regard. to commend you for having spent your provincial disaster grant 100%. However, the municipalities they're just at 17%. And this also affects the National Department of Copter in their reporting, because this is the grant that is coming from a national copter. So then I should think then MEC for copter, this is a matter that you need to look at. The other issue is in relation to this municipal spending on the disaster grants. We then also need assurance that when these funds are spent, they are used for intended purposes and that the community should benefit at the end. However, one wants to raise these issues in relation to the Provincial Disaster Management Plan as provided for in Section 39 of the Disaster Management Plan. Is the one Disaster Management Act, my apologies, is the one plan, the whole provincial disaster management plan that is used to rally all role players, and whether it is approved, and if it is approved, when was it done? If you read the provision of Section 38 of the Disaster Management Act, MEC similarly, the Act requires the provincial health disaster management plan to also to be developed that will cater for your EMS, medicine, to mention the few infrastructure and the rest. Do we have such plan in place as prescribed by Section 38 of the Disaster Management Act? If it's not there, when is it going to be developed? The other issue that one wants to also understand from your good self, Premier, does the province have a COVID-19 economic recovery plan? And what are the details thereof? And what is the commitment of the private sector towards its implementation? Is this also expressed in the IDPs of the municipalities? The other issue that one wants to also raise, you know, KZN is a tourist attraction province. Is there a plan to monitor compliance of tourism establishment with COVID-19 protocols? Then the other issue that I want to raise with the MEC for health, what will the Department of Health in the province consider to be their flagship or legacy project out of the COVID-19 response for long-term improvement of the provincial health system? We also want to know what are the details of the plan and budget for that, particularly noting that there has been various challenges with regard to the health system in the province. I'll then hand over to you, to Premier and the team, to respond to the question as raised. Should Honorable Mpumza come back, maybe we can deal with them as we deal with follow-ups if there should be any. Can I hand over to you, Premier and team, to respond to the questions as raised? Dr. Mkhize, is the Premier there? Did you? You want to start, MEC Nkonyen?
Yes, thank you very much.
Questions that are related to your area of operation. Sure.
Okay.
Thank you very much, Honorable Chairperson, and greetings to you. Greetings to the Honorable Minister, Dr. Nkosazana Dlamini Zuma. Let me also greet all
He has since left, eh?
members of the portfolio.
The minister has since left. Anyway, we'll convey our greetings.
Okay, thank you very much.
Thank you.
Thank you very much, Honorable Chairperson. I must firstly declare that we have been working as a team in the Provincial Command Council of KwaZulu-Natal, and that I was actually appointed as the chairperson of the Social Protection and Human Development Cluster.
MEC Konyeni.
Can you still hear me, Chairperson?
That's better. I wanted to say your network is giving you challenges, but you are better now. Proceed.
Okay.
If it continues, then I'll ask you to switch off your video for better connectivity. Let's continue and see how does it goes.
Okay, maybe let me do that. Does it sound better now?
That's much better.
All right. Okay, thank you very much. I was actually indicating, Honorable Chairperson, that we have been working as a team in the province of KwaZulu-Natal in our endeavors to try and mitigate against the COVID-19 pandemic. There has been a number of clusters, as the Honorable Premier has already indicated, that were dealing with various issues, but the main aim was to ensure that we work together with regards to mitigating against the spread of COVID-19 pandemic. And I think we can proudly indicate that we have actually tried our best, because there is an indication that the pandemic is slowing down. Honorable Chairperson, we have received a number of questions pertaining to the Human Settlements Department in the province of KwaZulu-Natal. Firstly, I must apologize to Honorable Mkalipi and indicate that maybe in future, she should contact me directly, because I know for a fact that she does have my contact number. But I will also forward my parliamentary liaison officer's number to her, solely because I have now realized that she has been communicating with eThekwini Metro through Mr. Appel Green, and unfortunately, they have not forwarded the issues to us as the province of KwaZulu-Natal Human Settlements Department. Mr. Appel Green is actually in the office of the mayor of eThekwini Metro. So maybe we need to improve our communications with regards to issues pertaining to human settlements in the area of eThekwini Metro. Having said that, Honorable Chairperson, according to how we are structured in the Department of Human Settlements, metros are actually managing human settlements development programs. As the provincial department, what we normally do, we receive the budget and we make sure that whatever eThekwini Metro has actually indicated through their business plan is supported financially, but they are the implementers, they are the human settlements developers, and we just play our monitoring role with regards to implementation of the projects. And with regards to the Brooks Farm projects, Yes, there has been challenges. That project has been a rectification project. In other words, initially there was a housing project in that area, and things went wrong, and the department had to go back there and rectify what had gone wrong at a particular point in time. And we are told, I have just learned that about 400 out of more than 400 units, many of those have been rectified. There are land-related issues that are being resolved currently by eThekwini Metro through social facilitation. That is currently happening. I couldn't get the name of the honorable member who had posed a question around de-densification. What have we done as the province of KwaZulu-Natal? Okay, thank you for Honorable Geza. Thank you very much, Honorable Chairperson, and thanks for the question. Yes, our approach as the province of KwaZulu-Natal with regards to de-densification program is that we should relocate people when we have managed to establish solid structures. That is what we are doing currently. Kennedy Road was cited as one of those informal settlements. We have decided to find a parcel of land where we can actually establish a high-rise building, because we always face a challenge whereby it becomes very difficult for us to find a parcel of land which is not far away from where people are residing currently. Remember, in informal settlements, people establish themselves as a community. Their kids go to nearby schools, so it becomes very difficult for you to relocate them to a very far away place. So there is always that consideration that we should bear in mind. We are in a process of relocating them. Konobia project is one of those projects whereby we have, which we have identified with regards to relocating people to proper solid structures. So that was our approach as the province of KwaZulu-Natal. And I think we must also indicate here, Honorable Chairperson, that our decontamination program has actually borne a positive results because people were thinking that maybe the spread of the pandemic would be located much more in informal settlements, but we became proactive as the province of KwaZulu-Natal, thereby implementing this decontamination program. We have not had even a single informal settlement that has been declared as a hotspot for COVID-19. I think our proactiveness has actually worked for us with regards to that, Honorable Chairperson. Because as I have already indicated that I am presiding over the social cluster of the Provincial Command Council, I think I can also respond to a question that was posed with regards to how have we been engaging the religious sector. We are deployed in various district municipalities as MECs throughout the province of KwaZulu-Natal. Like, for instance, I am deployed in the district of Ilembe. What we have decided to do when we, at some stage, were declared as an epicenter for COVID-19 in my district, we decided to involve all stakeholders, your traditional leadership, your religious sector, the business sector, the NGO sector, and we made sure that the information is cascaded down to where people are. Like, for instance, the traditional leadership, when they started to understand what COVID-19 is, they convened meetings of the Izindunas, and they made sure that there are no people who were moving around, scattered around, doing absolutely nothing, or even playing soccer or whatever. With their engagement in the district command council, their participation in the district command council really assisted us, because we managed to flatten the COVID-19 curve, working together with them. So, Honorable Chairperson, I think the issue of stigma, let me also deal with the issue of stigmatization, because that is one of the issues that we have dealt with in the social cluster and also in the Provincial Command Council. Yes, at some stage, we were actually affected by the stigmatization. There was an issue whereby people in the province of KwaZulu-Natal were actually mobilized, though there was no formal mobilization, but there was this notion that said, if you want to die, you must go to a hospital. Our healthcare facilities became really stigmatized at some stage. We discussed the matter, and we identified those salient points which were actually indicated by our people. Like, for instance, people were saying ventilation is not good and all those things. And we decided to promote oxygenation more than ventilation. We explained this thing. What does ventilation mean? When is it supposed to be applied, and vis-a-vis oxygenation? And we came up with an intervention program as the province of KwaZulu-Natal. Maybe let me stop there and allow other comrades to also comment. Thank you very much, Comrade Chairperson. Thank you.
Chair.
MEC for Education, MEC.
Okay, thank you. Thank you, Chair, and good evening to you, Chair, and all the
MEC, can I plead with you to mute your microphone in the meantime? The MEC for Health, thank you. Proceed.
Thank you, Honorable Chair, and all the honorable members. Good evening to all of you. On the question of the scholar transport, Chair, as a department, we are on record having said that we are severely underfunded insofar as the scholar transport is concerned. In terms of the allocation we get from national department as a grant, we get about just over 250 million per financial year. And if you take into account the landscape of our province, you will not be able to avoid a conclusion that indeed we are desperately or severely underfunded. And even if we were to make comparison with other cosmopolitan provinces, our province is largely rural. 74% of our schools are in rural areas. And with the history of deliberate underdevelopment in rural areas owing to our past, we were bound really to face these challenges. And really the issue of underfunding makes things difficult to deal with.
Currently, we are able to only transport about 58,000 learners across the province. And in our records, there is an additional of 117,000 learners who have applied for scholar transport, but were not able to provide for them because of the lack of funding. And we also concede that the number may be more, given the fact that there will be those learners who have not applied at all. But when you know the distance that they travel to school, you can tell that they do deserve to be transported. But the issue really is about the absence of adequate funding to run effective, proper scholar transport for all deserving learners. So we continue really to make these calls, because in the absence of additional funding insofar as scholar transport is concerned, we will not be able to really solve this matter. As I said, given the realities of the landscape of our province. So we will really appreciate any support in terms of calling really for more funding from the National Department as well as Treasury, so that we can improve really or increase the number of learners who are benefiting so far as scholar transport is concerned. The learners that are crossing the river, or that were crossing the rivers to get to schools, we have attended to those matters, and in spite of obviously these constrained financial resources that we had no other choice but to provide for them the scholar transport, because we had to make a choice between the lives of these learners as well as the available resources, and then we had to channel or reallocate in terms of the baseline, and so that we could provide for these learners who were crossing rivers scholar transport. The issue remains unsustainable going forward, again, as a result of underfunding. The provincial treasury, I think, gave us about 100 million, but it's a once-off funding. And again, in the next financial year, we'll go with our cap in hand to the provincial treasury to ask them to give us yet another allocation, so that we don't have to terminate scholar transport in other areas. So in the nutshell, the issue of the inadequate funding of the department as a whole, but scholar transport in particular, will make things very difficult for us to decisively deal with the number of challenges that we are facing insofar as this area is concerned. On the issue of the learner who unfortunately got raped after she was sent back to collect the mask, we have attended to that matter, or to those instances which we must indicate were unforeseeable at the beginning. But also, we are of the view from the department that parents should have exercised more caution, because all schools were given, or let me say, all learners in our province were given 2 pairs of masks, 2 sets of masks. And we would have expected that the parents will not allow a child to leave home without a mask when we have provided 2 masks as a department. That's why we are calling for an active and visible role of parents in helping us to manage the situation. Because if we provide masks and parents don't ensure that learners, when they leave home, they wear these masks, it's going to be a very tedious process to deal with. But be that as it may, in part of ensuring that such circumstances do not happen in future, even the regulations were amended to say if a learner comes to school without a mask, that learner should be provided with a spare mask if it is available, or any cloth that can be used to cover the mouth and the nose of that particular learner. And if that fails also, the learner must be kept in the isolation room, and the parents must be called to either bring the mask or to fetch the child from school. Those are measures that we've put in place to ensure that such occurrences do not happen in future. We have also tried, in spite of our limited resources, the department to provide extra masks in our schools so that they can attend to such instances in case they happen. I must also indicate here that now we are observing another reckless or another challenge as a result of recklessness again. I think now they know, these learners, they know that there are extra masks in schools. So a number of them now show up in schools without mask, knowing exactly that we'll either give them mask because there are extra masks in our schools. And that is going to cripple our interventions because they take these extra masks again home and they don't bring them again. They don't bring them back. So the stock that we put for contingency measures is also getting depleted because of these reckless occurrences. Now, we will continue, obviously, to plead with the parents to ensure that they make sure that learners leave home with masks, to plead with learners that the 2 masks that you were given, make sure that you use them instead of coming to school without the mask, as it were. So those are the interventions that we have put in place. The last point is on the issue of water. Yes, there's still a challenge insofar as water is concerned in our province. There are districts which are known to be very challenged in terms of water provision, not only in schools but in communities. You count Zululand, you count Umkhanyakude and such. Those are districts that are under stress in terms of water provisions. And because schools are in communities, obviously, they will also be affected. So we rely on the capacity of municipalities to provide water in our schools, but also as an additional measure to ensure that we are able to have water in all our schools continuously, but also to cap the bill that we receive from municipalities, which, if it is not properly managed, is going to cripple the Department of Education. We've embarked on the program of boreholes. And so far, there are 600 schools that have been identified to have water underground, and therefore we have said work must continue in those schools to drill boreholes as part of sort of a lasting solution in the problem of water. We've also commissioned studies in other schools across the province to check the availability of water underground water, and where studies come back positive in terms of the availability of water, we will continue therefore to drill boreholes in those schools. One, as part of ensuring that there's sustainability in terms of water provision, but also it will help us to cut costs that are related to water provision. Thank you, Chair. Those were the questions that were directed to the Department of Education.
Thank you so much, Honorable Mshingu. Can I task you to check with the Premier whether it's a connectivity problem? Because we see that he's no longer here on the platform. The members want to know his whereabouts. Can I assist you to check for me? Because yes, the minister told us that he's going to be leaving. The members feel that the questions that were directed to the Premier, that the Premier must respond. Can I task you, Honorable Mshingu, to check?
I can help you there, Chair.
Oh, okay.
Yes. So my Chairperson, the Premier sent a message indicating that he has just been hit by load shedding. As a result, he lost connectivity. So he just was booted out of the meeting because of that.
Okay.
Yes, Chair.
It's fine. I hope you'll continue to try to reconnect as we progress. Yes, that was the issue. Can I hand over to you then, Mrs. Melanie, to deal with all the health-related questions?
Thank you very much, Chair, and appreciate the questions that have been given to us by the honorable members. Chair, let me start with the issue of Northdale and the question that was raised by two honorable members in relation to Northdale in particular. I think I will deal with that in one go. Firstly, Chair, let me just indicate that because of the doctor-patient privilege, we cannot announce the cause of death of the patient that passed on at Northdale. However, there was an engagement between ourselves as the Department of Health and the family, and the cause of death was explained to the family, and it was the reason that the patient had actually been brought into the facility. But I also want to indicate, Chair, that we had announced, of course, immediately when we received the report of that facility that was being utilized as a flu clinic, we then immediately went into the facility to find out for ourselves what was happening. But let me firstly explain, Chair, how we got to be where we were in Northdale. Around April, the Minister of Health instructed all facilities to create what is called flu clinics. And the intention of these flu clinics was to screen right at the gate or at the entrance of each facility, each and every patient and staff member or visitor that comes into the facility. And if you are a patient and you are coming to a facility, you will then be screened at the entrance of the facility. And during the screening, you are asked questions. And once you have picked up to have at least one symptom, you are then redirected into the flu clinic. The flu clinic was meant or is meant to be a facility or a structure that is just outside of the main building, so that those that could be patients under investigations don't mix with the rest of the patients, because hospitals, as we might know, they become hotspots because that is where all our sick people actually go. So the route of the flu clinic, Chair, is that at the beginning of the facility or at the entry point of the facility, you have a screening facility. Now that screening facility could be anything between a small guard room to a gazebo to a tent, depending on the capacity of that particular facility. Also, because while you are being screened, that doesn't take more than 15 minutes. So you might not need anything that is firm in terms of infrastructure. So if you are found to have symptoms, you are then moved or redirected to the flu clinic. And in the flu clinic, then an in-depth investigation is conducted by the clinical staff there. And if it's necessary for the clinical staff to bring in doctors, and that is done. Now, all our facilities were expected or were instructed, in fact, to create space within their own facilities for these flu clinics, and they all did that. However, there are a few facilities that came back to the provincial management and said, unfortunately, because of the bed utilization in our facility that is very high, we are unable to move patients around, and as a result, we can't find any space where we can create a flu clinic. And as a province, we then made sure that we brought in some temporary structure so that they could utilize as a flu clinic. And you know, facilities became very creative, Chair, with this kind of flu clinic in particular. When you go to Edendale Hospital, they utilized what used to be a cafeteria, and they converted that into a flu clinic. And there are in that area there are rooms where people could actually be seen and attended to by doctors. When you go to Port Shepstone Hospital, for instance, they utilize their OPD ward because they have the facility, they have the infrastructure, and they could move patients around. You go to a hospital like Murchison, they have an old chapel within the building, and they closed all the other entry points and they utilized that chapel. I mean, all the facilities did that, Chairperson. Now, the difference with Northdale and the issue of management there is that when they realized that they don't have any structure, or they just couldn't come up with any structure, they decided that these gazebos or these tents that were meant only to screen patients, not as flu clinics, they utilized those as flu clinics. Now, when we met with them and we met with the staff, it became very clear that purely it's an issue of management, because had they not had the capacity, they had the responsibility as management to go to the district level, to go to head office and say, we don't have the capacity to put up the flu clinic, but we also don't have the budget. And we were willing and ready to do so ourselves as a province. So that is why the issue of the flu clinic in Northdale becomes a management issue. When we arrived with the head of department, we immediately, after listening and understanding what was happening, put on suspension the acting CEO, the medical manager, the hospital manager. And I put in place a team that was going to investigate for us, and we gave the team about 3 days to investigate. And certainly on a Friday, a preliminary report was provided to us. And this preliminary report indicated that it looks like there are charges that will have to be that the medical manager, the medical manager and the nursing manager will have to report to account for. However, the preliminary report also suggested that there might be a need to also investigate or some disciplinary measures to be put against the human resource manager. So we then agreed that this team will continue now and delve and investigate thoroughly and bring us a completed investigation. So we are still awaiting that particular investigation so that we are able to act on it depending on what the outcome of the investigation is. I must indicate, Chairperson, that we then put in a team in place in that facility to manage the facility for the next couple of weeks or for the next few weeks, so that we are able to bring systems back in place. We are able to bring management in the facility, because it became very, very clear that no one was managing in the facility, no one was taking responsibility for the patients, and no one was taking responsibility for how our patients were being treated. So that is the issue of Northdale, Chair. But I must indicate that immediately when we received the preliminary report, we also issued a statement indicating that we had received the preliminary report, but we are awaiting the final report, and we will act on the report once we have received it. So we are still waiting on that, Chairperson. Honorable Mkalipi is asking, how do we follow up on contacts and contact tracing? I must indicate, Chairperson, upfront that this has been a bit of a challenge for us for quite a while, but it was a problem in particular in eThekwini because of the nature or because of the size of the population in that particular area. However, we then had an engagement, like Ms. Nkonyani correctly indicates, in the social cluster and in the Provincial Command Council, where we decided that we are going to have an intervention strategy. And we had intervention strategies that were speaking to the different districts because circumstances were not the same. In eThekwini, for instance, you would find that some people were not willing to actually indicate that they are positive because they were afraid that their community will want to chase them away, and they would not want to be associated with that kind of testing. So we then came up with a strategy that says, once we receive the numbers or the data of patients that have been found to be positive, the province has a responsibility through the districts that are affected to make sure that each and every patient is spoken to at least within 12 hours, so that we are able to establish whether that patient has facilities or has sufficient facilities at home to self-isolate. If they don't, we then take them to our own facilities, because we had actually created enough beds to be able to isolate patients, chairperson, in our facilities. The other challenge that we had, and that was affecting our contact tracing, was the fact that we did not have enough teams that were contact tracers. We also didn't have enough vehicles to be able to have a turnaround time of 12 weeks. Around May, we then employed more contact tracers, and in the process of employing more contact tracers, we engaged with the local municipalities. For instance, in eThekwini, we had an agreement with the eThekwini municipality that they were going to provide us with vehicles, and these contact tracers will be able to visit patients that needed to be visited despite the time, despite the hour. So we were able to actually contact to contact those patients that needed to be traced. Of course, from time to time, there will be patients that fall within the cracks, and that's why we called on members in the provincial legislature in particular, that where members were able to be contacted by communities, they should be able to get hold of us, and the majority of them, chairperson, really did that, and they would contact us and will be able to go to those areas immediately. So we did have to up our game in relation to contact tracing, but that is something we had to do around May, June, and we were able to bring up or implement a turnaround strategy in relation to that. Chairperson, in relation to Eddington Hospital, let me firstly just indicate, Honorable Mkhaliphi, that Eddington is not a COVID hospital, as in the strict sense, as we have made Clearwood Hospital to be COVID, as we have made Richmond Hospital to be COVID, as we have made Nimea Hospital in Utrecht to be COVID. Eddington Hospital only has about eight isolation wards that are on the site. Of course, Chair, all the hospitals, all our health facilities will have side wards wards that we call PUI wards, which are patients under investigations. By nature of our facilities, Chair, you will have to have a ward like that. In other words, you would have a patient that comes for a different disease. Maybe their BP is shot up, their sugar diabetes levels are quite low. And when they come in and we find that they have symptoms, we need to put them in a separate ward, take their swabs and test them, so that we know that whether they are COVID positive or not. So all our facilities have PUI wards, and then some of our facilities will have isolation wards, not all of them, Chair. And where those don't have isolation wards in that district, we always have a referral system where we are referring our patients, and that is what we have done. So Eddington is one of those facilities that would have had a PUI ward, but would not necessarily have a big isolation ward because they only have about 8 beds. So their patients that turn positive in Clearwood are taken the patients that turn positive in Eddington Hospital are then taken to Clearwood Hospital because they are not very far apart, or they are taken to Pixley Gaisagaseme Memorial Hospital, chairperson. Let me just indicate that Honorable Mkhaliphi is correct. She raised some issues with the Premier in relation to matters in Eddington, and she met with the HOD and the CEO. But I must indicate, Chair, that the issue that was raised or the complaint was given to Honorable Mkhaliphi, saying that there is only one lift that has been working for the past 5 years, was disputed on the spot. And I must indicate as well, Chairperson, that is not correct. We have had challenges, and we continue to have challenges with the lifts in that hospital in particular. But out of the 10 lifts that are supposed to be functional, you often find that you often find that between 5 and 4 are operational. At West, we find that there are 3 that are operational. Now, this is a challenge that we have, and it's a challenge that we are working on. When I was first appointed chairperson as MEC, one of my first challenges I had to deal with was the issue of lifts in Eddington. And we met with the service provider who is supposed to be servicing the lifts in that hospital in particular. And as a result of our engagement, it became clear that the service that the Department of Health was getting out of that contract was not up to standard. And we then agreed as the department that we were going to re-advertise the tender for that particular hospital and for the lifts in that hospital, so that we are able to get a service provider that will be able to assist us and will be able to pay attention to this hospital in particular. Having said that, Chair, the issue of lifts in Eddington are going to continue to be a problem, primarily because of the location of the hospital. Eddington Hospital is located just opposite the sea, Chair, as you know, it's on the beachfront, and it's on an area where you usually have a lot of hotels, and it is a facility that has close to 8 stories high. So the building itself is quite high. Now, the rust or the salt air that comes from the ocean affects our lifts continuously. And the rust that is always there in the lifts is what has been affecting our lifts. As a result, Chair, we are currently looking at options of moving the hospital away from where the hospital is currently and building a structure that will actually be manageable and that will be friendly to patients. Now, that is something that's a plan that we started working on in January, but because of COVID-19, it had to be stopped around March, but we are getting back at it now that our numbers are gradually beginning to go down. And as soon as we have reached a conclusive decision, this is a matter we will take to the Provincial Executive Council, because we are going to need the support of the Executive Council in moving the hospital if we find that it is possible for us to actually move the hospital. In relation to the patient that Honorable Mkhaliphe is talking about, Port Shepstone, I would suggest, Chairperson, that Honorable Mkhaliphe gives us the name of the patient and maybe the contacts through the Premier, as she has done previously, and will be able to follow up and attend to the challenges that the patient is facing. It is correct. Honorable Mkhaliphe is correct. It's not acceptable that a patient would be faced with the same challenges for almost 5 years and kept being referred back and forth. So if we could get the details, then we will definitely deal with that challenge. Honorable Hadebe, Chair, asked whether in the province of KwaZulu-Natal we did not have a challenge of stigmatization in relation to isolation and quarantine, and did our people want to come to our facilities? MEC Konyen, I think, has spoken to that, Chair, but I want to add that yes, while we are in a rural province, but in other areas you would find that you live in a compound or in a household that has about 3 or 4 houses with a couple of rondavels, and if it's possible for any person to indicate that they are the only ones who can utilize a particular rondavel for the duration of the isolation, we would then leave that patient at home, because it will be clear that they are able to self-isolate. But where it became clear that while there would be a number of houses in one household, but even the occupants or family members are quite many, then we would insist that those patients must come to our facilities, and we would then isolate them. Chair, the issue of stigmatization is something that we faced and we dealt with, and as a result, we found that people that were coming to our facilities were really, towards the end of July, early August, the numbers were really dwindling. One of the reasons that we were given, Chair, is that the communities were beginning to stigmatize people that are infected with COVID-19. MEC Nkonyeni will give you an example of when she visited her childhood home, and as she was standing around having a discussion with some 2 local women, They just left her there standing, and the reason why they left her standing was because another lady was approaching them, and this is a lady that was said to have been positive, to have been COVID-19 positive. They therefore did not want to isolate, to associate with her. So our people found it very difficult to come to our facilities because they knew that if they would then go back to their homes, some of them would be stigmatized and some of them would be treated quite badly. It got so bad, the issue of stigma, Chair, that even when we had to go as the Department of Health to fetch a patient willing to come to our facility, sometimes they would say to us, don't stop in front of my gate, please drive down 2 streets down or 3 streets down, I'll meet you there because I don't want my neighbors to see me getting into the car of the Department of Health. So it has been a challenge. What we decided to do as the province, Chair, was to run a campaign in the media and in our communication strategy of ensuring that we speak to our people and get everyone to understand that COVID-19 should never be something that is stigmatized because any of us are at risk at any given time. Chair, the number of quarantine sites, or Honorable, because I was asking how many quarantine sites do we have in the province of KwaZulu-Natal, we decided, Chairperson, that each and every district must have its own quarantine site. And we found that in other districts, we would have more than one quarantine site, and we would then also have an isolation site. So every district had about 2 quarantine sites, Chairperson, and the budget that we had planned is a budget that we put together, and you know, it was a budget for infrastructure as a whole. So that's where that budget came from. But if members want the exact numbers, we can always submit those to the Chairperson. So I'm saying, Chair, in every district we had about 2 quarantine sites, but we also had isolation sites in those facilities. Chairperson, you were asking if we have plans in respect of the Disaster Management Act, and we do have those plans, Chair, that relates to EMS, that relates to pathology services. We can submit those, Chair, if you want us to do that, but they are in place, and the department is able to actually work according to the plans. Let me then respond to the final question that you asked, Chair. What are the legacy projects that we think COVID has assisted us to put in place? For the Department of Health in KwaZulu-Natal, Chair, is the issue of infrastructure improvement in our facilities in particular. What we decided to do when we got our first case, and 2 days later, our 10th case as a province, instead of just creating field hospitals, we decided firstly that we needed to look at our facilities, we needed to upgrade our facilities, Chair, and make sure that at least more than half of the funds that we are spending should be spent within our own facilities, because that then becomes an investment. As a result, at least all districts had at least one facility that we were improving. In eThekwini, Chairperson, we decided to go to a facility that is called Clearwood Hospital. And this is a facility in essence that really was beginning to have a very low bed utilization. And the Department of Health was now utilizing it almost as a step-down facility. And we took the very low patients that they had, the very low number of patients that they had, and we moved them to Wentworth Hospital. And we converted, Chairperson, literally almost the whole hospital into a COVID-19 hospital. Now, what do we mean when we say we converted it into a COVID-19 hospital? It means literally all the wards that are in that hospital are either 4-bedded wards or 3-bedded, 2-bedded, some are single-bedded. So this gave us an opportunity to actually, Chairperson, rework our facilities and repurpose our facilities. Chairperson, it gave us an opportunity to even bring equipment in that we did not have previously. Now that we have fixed Clearwood as we had, it means as a Department of Health, we need to then rethink about what we are going to be utilizing the facility for beyond COVID-19. And already we have plans, Chairperson, and we are quite excited about those. It has also given us an opportunity to invest in preparation for NHI. Remember, Chairperson, when we implement NHI, or when we are going to be expected to implement NHI, it's not automatic that all public health facilities are going to be accredited to be NHI sites. So there is a body, an independent body that's going to be coming to our facilities and be looking at them and give accreditation, and some of the accreditation will depend on how the infrastructure is structured. So this gave us an opportunity to invest. So I was speaking about Clearwood, Chairperson, as one hospital that we converted. In Umgungundlovu as a district, we converted a hospital that was called Richmond Chest Hospital, and we converted it entirely. We made it into a COVID hospital chair. It's a hospital that had a very, very low bed utilization. It had very low beds in particular. But after this, we are getting more than 90 beds out of that facility. And we've decided already that now that we've repurposed that particular facility, we are then going to utilize it after COVID-19 as a district hospital, because people of Mkungundlovu actually in that area, in particular Richmond and the Ikopo area, they did not have a district hospital previously. So we've now been able to get a proper district hospital. So we've done that, Chairperson, in a number of our facilities. In Amajuba district, for instance, we've converted a hospital that is called Nimea Hospital, one of those very old hospitals that were built by the churches back then. We converted that, and we got a proper hospital out of it, and we are going to get a district hospital out of it, and we'll be ready for NHI when it comes. So Chairperson, for us, one of our legacy projects, it's all these facilities all over the province that we have had an opportunity, or that COVID enabled us to actually repurpose, fix where we needed to fix, and build where we needed to build. Of course, we were also given an opportunity to employ more staff, Chairperson, because that is one of the other challenges that we had in the province, where we really had a very low staff, particularly in areas that are not clinical. We had enough nurses, professional nurses, enough doctors. However, we didn't have enough enrolled nurses assistants. We didn't have, or we continue still though, not having enough admin staff and general orderlies. So COVID-19 gave us an opportunity to employ all those categories that we needed. Although, Chairperson, we were given an authority to employ just for a few months, but it has elevated a lot of pressure that we had as the Department of Health in KwaZulu-Natal. Thank you very much, Chairperson.
Thank you, MEC Simelane. MEC Tlomuka, can you deal with the questions that are related to your portfolio? Just to let you know that you remember I've interrupted Honorable Horneveld asking questions in relation to Newcastle Municipality. I've asked him to submit such to the committee secretary, which will be forwarded to you tomorrow, and then we'll expect you to respond to him in writing by Tuesday next week. Can I hand over to you so that you deal with the other questions that are related to your area of work? MEC Tlomuka?
Yes, Chair. I'm sorry.
Okay.
I was trying to, I had the network problem here. Chair, thank you. Let me greet everyone. I think the colleagues have tried to cover some of the issues that were raised generally. However, Chair, I won't be long because most of the issues generally have been covered. I will be just specific to the issues that are specific to the department. I think one of the issues that have been raised, I want to also, Chair, sorry to greet my Minister, Dr. Umama Zuma, honorable members, all present.
Long gone. She's long gone. She told
In-
me she was not going to stay long. I see you also miss her. She has since left, but it's okay. We'll convey the greetings to her.
in her absence, Chairperson, thank you for that. However, Chair, the issues that have been asked for the department, one of the issues that have been raised is the issue of poor revenue, poor collection of revenue from municipalities. I think the Premier in his presentation, he indicated that as the provincial government through culture, we developed an economic recovery plan, which we invited all municipalities in all 54 municipalities in KwaZulu-Natal, where we develop a plan how we're going to recover a revenue from municipalities and how we're going to assist the municipalities. And we presented that recovery plan to cabinet, to command council. We can provide that detailed report to the committee if the committee want that document as a working document to assist the municipalities. And indeed, there are challenges. We must, Chair, agree that municipalities, they are suffering because of this COVID-19 pandemic. I think I just want to deal with that issue. However, we have the continuously engaging municipalities to ensure that they are supported as per Section 154 of the Constitution, and even those municipalities that 8 municipalities that are under Section 139 were also supporting them. We have also a supporting plan for all those municipalities. And the grant that we received, a disaster grant that we received from national, as per the guidance of the National Treasurer of prioritizing the MIG, they have received that grant. However, they have given 3 months. That grant of disaster grant were transferred directly to municipalities in June, with the condition that that grant must be spent within 3 months. And as a COGTA, we are receiving reports on the monthly basis. However, we are supporting those municipalities, and we are certain that the municipalities, they are going to spend the grant, the disaster grant that were received direct from the National Treasurer. We can provide the monthly report, Chair, to relevant structures to prove that we are in the process of ensuring that we spend what we have given by the National Treasurer, but also the people of KwaZulu-Natal, they receive services as they are required to do so. On the expenditure for the issue of Umkhanyakude, Chair, Umkhanyakude, they have disputed the expenditure that was presented. However, we are engaging the district to assist them to ensure that they provide an accurate report so that when we provide a detailed report to an executive council of KwaZulu-Natal and to a command council, so that when the Premier present to a national or to this portfolio, he provide an accurate report. We can, Chair, provide the detailed and audited accurate numbers in terms of the expenditure. On the issue of boreholes, Chair, we appointed service providers to drill boreholes across the province. However, it is impossible to provide the expenditure to date because there is no expenditure that have taken place because most of the service providers, they have started to establish the site. So that means there is no invoice that have been submitted to our department. As soon as they submit the report, we are going to provide a detailed report on the expenditure. And remember, the expenditure will go to the work done by the service providers. And the work that will be done in terms of grading will be tested, and water will be tested on the work done by the lab, because whatever that we do, we need to be certified by the relevant structures. Chairperson. I think the last one, Chair, if I'm not mistaken, I think the issue of water tanker that was raised by Honorable Comrade Slengiwe was of Zululand. Zululand district, they've acknowledged, they did acknowledge that the truck that wasted water at Pongolo is their service provider. They've appointed service, they hired water tankers for different service providers, and they have already terminated the contract of that contractor that wasted water, and they have disciplined the service provider. I think from us as Cooperative Provincial government, we can't do much because there was a contract because a Zululand district and a service provider. Our role was to investigate what happened, and the district, they provided the report, and part of the consequence management is that they have terminated the contract because what the contract did was outside the contract. I think the issue of Newcastle financial challenges, Newcastle Chair, we have provided guidance that there will be a platform where as an MEC for Cooperative, we will provide a detailed report to this portfolio at the correct time. So I'm not going, Chair, to respond to that because you guided the meeting how we must deal with those issues that are specific to the municipalities. I think at the moment we're dealing with the issues that talk to COVID-19. I think, Chair, from where I'm seated, we've tried our level best to respond to the issues that have been raised by the honorable members in this August House. Thank you very much, Chairperson.
Honorable Chairperson, it's Gonyeni.
Yes. Yes.
Chair, may I humbly apologize on behalf of our colleague MEC for the Department of Social Development, MEC Koza, who is facing challenges for connectivity in her area of Ixopo. But she has indicated that her HOD is here if the chairperson may allow her to respond to some of the questions that were posed. Thank you very much, Honorable Chair.
This is what I wanted. I wanted to call the name of the MEC. Thanks for that, MEC. Can I hand over to the HOD to respond to the social development related matters? I believe it's Ms. Vilakazi who will deal with the matters.
Thank you very much, Honorable Chair, honorable members. Thank you for the questions. With regard to the question that was asked by Honorable Hussein, with regard to the officials that are implicated as far as the issue of procurement of PPEs in the Department of Social Development, there are 11 officials that are affected. They were put on precautionary suspension. They include one at the executive level and 5 chief directors, the director responsible for SCM that was acting, as well as the officials within supply chain management. One official has since passed away, and then one resigned immediately before the report, the forensic report was given to the department. So as of now, what happened is that we requested support from the Office of the Premier because we felt that due to the fact that some officials are senior, would not have the capacity to actually manage the process. So the Office of the Premier assisted us a great deal together with the Department of Public Service and Administration. So that's why then we started the process of putting the officials to a precautionary suspension. I must indicate that due to the volume of the work, the official that was allocated to us also had some responsibilities as far as arbitrations and so on are concerned. Then we approached the Office of the State Attorney to assist the department. So that's why the process is right now. We are preparing the finalizing the charges that will be given to the officials, and then we have the plan in terms of when are we starting the issue of the disciplinary proceedings. I think I can go as far as that, Honorable Chair, but we are monitored by the Office of the Premier, and we submit the reports in terms of the progress as far as this matter is concerned. Thank you very much, Honorable Chair.
Thank you so much, HOD. Can I have follow-ups? I have Honorable Mkalipi, Honorable Hussein. Who else wants to follow up? Okay. Can we start with you, Honorable Mkalipi?
Thank you very much, Chairperson. Thank you very much to the team who responded to all our questions. I just want to make follow-up on the following one, Chairperson. Thanks, Honorable Sis Peggy. Yes, I do have your number, and I will liaise with you, MEC. But I just want to clarify the issue of Ms. Apple Green. She is a former HOD in the department. I believe that she's no longer there. I know the Apple Green that you are referring to, the one that is working with Honorable Kawunda in the council, is not that one. This one was a former HOD of the department, and I believe that she's no longer there. Nevertheless, the issue of Brooks Farm, I'm very glad that the MEC is also have an understanding of that project. That is a very old project, and there are some challenges in terms of our land issue. And I must say that in front of the chairperson of the portfolio committee, that matter came here, but through the municipality, after the petition of the ward, have petitioned the municipality to come and explain here. So therefore, I just want to say that I'm going to make a follow-up in your office in that regard, because after that meeting, chairperson, I have contacted Uphato, was Teguini, and we agreed with Uphato that we have to go and verify those houses, because here the engagement was to the fact that around 400 houses, and the municipality and the department at a provincial level are trying to rebuild those houses. It's a ratification project, but out of 400 houses, 55 of them, they don't have enough land. And I said to them, because I know that project in and out, so some of those houses, they do have land. That is one. Secondly, if there is a particular house that does not have land for the beneficiary to benefit in terms of the new house that is provided, there are so many options that the department, the municipality can come with. For instance, the project is very old, is more than 20 years old. So what stopped the department to say, okay, here, Gas is Peggy, you don't have land, we have explored so many possible solutions, but there's no land. So therefore, let us give you a voucher. Go and get a window, go and get a door, go and get something to make sure that your house is not falling. So those are the options that let us sit down with the municipality and possibly with the person from your office to explore some means of resolving those issues. The second point is that after we raised that matter of Brooks Farm here, correctly so, the mayor also said here after he received those complaints, he also put it to his team to go and verify. And we are getting a feedback also on the ground to say there is a team that is going and check per house. But now, no, we can't continue. The liaison officer is saying, no, we can't continue with this project or to build this particular house because all surveyor, abavela emkhandlweni, they came here and they've done their work as municipality surveyors, but now they are waiting for surveyor by province, and therefore the process is stopped. I'm particularly raising this point because it has affected one an old person there in the area that was also a subject of discussions here. So as a matter of a way forward, I will liaise with the PLO MEC to take this matter forward together with municipalities because as you mentioned now, there is a very old project and is unfair to people of Brooks Farm. That is one that I wanted to clarify on under housing. On education, MEC, the issue that was raised by Honorable Tikeleso here about Anneli Mpedi, that child, I'm not satisfied about the answer that the MC is giving because it looks like now the MEC want to shift the blame on that particular case because that child, the issue of the child that got raped when she was told by the security to go back home, that child does not have a mother. Her mother died when she was 2 years old, and we have followed her story to assist her. The reason why she has to move from KwaMashu to Ikobo is because the family ugogo wakhe said the father of the child, we have not taken care of the child for a long time, and the child does not have a birth certificate at the age of 12. So they took the child back to Ikobo in order for the father to apply for a birth certificate. Can you imagine? And in the process, the child gets raped, and the father does not have unkosikazi, and the father is working somewhere else. As a result, the child ubehlala kamakhelwane. So therefore, that issue ukuthi nabazali, they must play their role. This particular one, MEC, does not have a mother in Dandane. As a result, they took her back to KwaMashu, and I assisted her. I took her, I make sure ukuthi she got a birth certificate. But again, as I alluded from the beginning, that your office is very responsive. So I engage your chief directors there, and the child has got a new school, KwaMashu. She's got a birth certificate, all is well. But I just want to clarify that no, we must have some programs that will also look beyond from the teaching only, just to check such cases of this particular child that at home after this ingane ibuyela kuphi, and mhlambe ke the MEC as well from the office, it will be a good thing just to follow up in a case yale child ukuthi is this rapist arrested and how far and so on, even a family ibone ukuthi the department ikhathalele. That is one. MEC of Education didn't respond on my issue that I raised in terms of e-bridge. I remember I read on one of the articles whereby the MEC committed himself kuphume a very bad picture in terms of ingane funeke ziwele umfula before ifike esikoleni. And the MEC, when he assumed the office, he promised that no, this is a very bad situation, so the department will take care of it. So that's why I'm making a follow-up. How far? I know that you are underfunded. We know very well, we have engaged with you. You have opened your door in your office. We talk about everything, but this one is also a challenge in the province. Maybe you can update this committee. Ngoba kuyinto ebuhlungu. And then on the health, MEC of Health, thank you very much. I will, through our secretary of the committee, as I have also mentioned here, with your HOD, I aga respond, send a SMS, aga respond, send a message, aga respond. Maybe the MEC Health, maybe can also give us some details. If HOD does not respond, even noma umbhalela MEC, umtshela ukuthi kunomama okhaliswa yinhlungu every night. Can I get a person there with district level asamagate who can resolve this issue? I try my best. I phoned Market clinic. I spoke to a person who said he's a deputy someone because the one who was in charge was not at the time. I explained to her, this mama need a referral to go to Potchefstroom. I engaged with the CEO of Potchefstroom, but she's on sick leave now. But she was very responsive as well. So I said, let me just engage the HOD. So in order, mama, angaloku ebese inhlungwini. And the stories ka mama MEC, as umama nawe, as inzala bantu, it will also get you affected. Uma ngabe ethi ukuze athole ukudla okuya ngasethunjini, she have to go as a domestic worker nalo mthungo omhlupha every day ka 15 years, nengane yakhe ayiyekise ukuya esikoleni, afike avule ejaldini, ingane isebenze ukuze bathole isinko sengasethunjini. So what is so concerning is that umama can go to hospital and maybe bakwazi ukuthi bamsize ngalo mthungo, but if the department awuzwa noma usuthi please give me a person to facilitate this, the HOD is not responsive, maybe please give us someone in your office who's going to take up these issues, because we know you as an activist. The issue of Eddington, thanks very much for the response. And then the you also department can want to look for another site to move that hospital. But in the meantime, MEC, I want to put to your attention that there are so many issues there. I was just making an example in passing in terms of Ama Lifta 7 and so on. Thanks for correcting that. But there are so many issues. I even raised an issue of HR, Uguti, in terms of the staffing. What transpired in that meeting, Uguti, even there is a challenge in terms of the staffing. Uthola ukuthi akekho umuntu who's responsible for laundry. And as a result, kufuneka umuntu ahambe kuthathwa i-cleaner elingakwazi ngisho ukufunda something on paper ukuthi how is going to manage this thing. So those are the issues that emanate from that meeting. So if the MEC can address those issues, because that hospital, once we are looking for another place, but at least this hospital must be in running. And there is an issue of allegation of racism. Maybe that's where it started when I came into contact with the CEO Dangisa to say there are workers who are complaining about a particular matron in theater. And Udlangisa tried to intervene the way he did, but as a result, the very same matron who is, as you mentioned, that hospital is very old, was there during apartheid. And I understand that during those times, those people were employed and they thought and then after Udlangisa intervened in terms of what I've raised with him, the particular matron challenged that particular person because Udlangisa mentioned Uguti Mrs. Mkhalipi have complained about you. In that meeting, then Umetron went to HR and reported this poor young a woman, and she was suspended. She was suspended during COVID, and because she's from Le Kokopo as well. So it's a matter that the MEC might have looked at it to resolve it, because it's an ongoing outcry of that hospital. Management level, plus the shortage of staff, plus the allegation of racism. That is the last one. So MEC of Cooperative, yes, we are still going to come back to us. We are going to raise issues pertaining but please comment on what I have raised in terms of billing system, particular of Tegwini. And we have engaged with municipalities of KZN. There is no clear plan in terms of interventions. People of Tegwini are subjected to pay huge bills. Others, they have lost their income, they have lost jobs. So when we ask the municipal, I'm sure there must be a way from the Cooperative at a provincial level to come with systems, to come with intervention strategies, because people, they must not find themselves can't pay for the services. Thank you very much, Chair.
Thank you, Honorable Mkhalipi. Honorable Hussein.
Chair, I just want to thank you very much. I just want to raise the issue about the Premier disappearing. And I want to say, Chairperson, I don't believe the story that he was hit by load shedding, and I'll explain to you why. You see on your screen there, Chairperson, there is something called a hide conversation. If you click on that, it shows you exactly when somebody has left and when they have joined. And Honorable Gisela Opperman joined our meeting at 8:34. I asked her, she will tell you now. We all know that load shedding happens only exactly on the hour. And the Premier left the meeting just before Gisela joined. So he wasn't hit by load shedding, he was hit by fear. He didn't want to answer the questions. And if what I'm saying is incorrect, the Premier will come back and he will answer. And he was afraid to answer the question about Zandile Gumede. That's why he ran away. And I'm disappointed, Chairperson, because you would expect that the Premier of the most corrupt province in the country will make their effort to actually provide an explanation and give this portfolio committee the hope that he's doing something about it. But instead, he ran away. That's all I can say. He ran away. And we will never get an answer from him because he doesn't want to answer about Sandile Gumede. That's why he disappeared. Anyway, let me deal with something else now, Chair. I heard that the MEC for Health is talking about the lifts in the Addington Hospital, and because that hospital is on the beachfront, the lifts are getting affected by rust. Chairperson, if you come to Durban beachfront, every single building along the beachfront has all got lifts. Some of the buildings are 25, 30 stories. There are hotels along the beachfront. They all got lifts. How is it that all of these buildings are able to have their lifts operational, but a government department can't keep their own hospital lift operational? It doesn't make sense to me. It's the most absurd thing I've heard in my life. And on top of that, you want to move a hospital. We've just refurbished that hospital in a few years ago. There was a complete refurbishment done, spent millions of rands, probably hundreds of millions. And now they want to move the hospital again because it's on the beachfront and the lifts are getting affected by the sea salt. It's the most craziest thing I've heard in my life. I'd like to hear from the MEC of Health, what is the justification for moving that hospital? Is it because of the sea salt? I can't believe it. And you can't say to me that that hospital was there for so many years that you can't continue refurbishing it and make it work. You're going to spend even more hundreds of millions to move the hospital elsewhere. Chair, I know that the MEC for COCTA is going to come back to us, so I won't put this question to him now. I did raise it earlier. He didn't give us a full explanation, but I don't mind waiting for him to come back with the details. And the question, just to remind him again, is that which municipalities in KZN have they flagged for COVID-19 expenditure that they are concerned about? Perhaps he doesn't have that information available with him now. If he's got it, he can share it with us now. But if he doesn't have it, can he please make sure he bring it back then on the next occasion that he comes before the portfolio committee? And then lastly, Chairperson, I was encouraged by the information I think the HOD had shared with us about the suspension of about 11 officials on the blanket scandal. It's encouraging to know that when these incidents occur, that the department takes quick action and that people get suspended and they're going to get held accountable, which is positive. But that's not the only scandal that has rocked this department. There are many other scandals in many other departments. And we didn't hear from the rest of the departments what action are they taking against officials who have been fingered in these COVID-19 corruption in the province. There's a lot of corruption going on here in KZN. And instead of addressing it, the Premier ran away. I hope he will come back next time and he will explain to us. Thank you very much, Chair.
Thank you, Honorable Hussein. Honorable MEC Tomuka. There was an issue that was raised about the low expenditure of the disaster grant by municipalities. That is currently at 17%. Can you mute your microphone, please? Honorable Tomuka, mute your microphone.
Okay, no, thank you.
Can you mute your microphone, please, Honorable Tomuka? Yes. So I'm still asking about the issue of the municipal disaster grant. That is at 17%. The spending rate there is too low since the money was deposited on the 6th of May. Currently, the province is at 17%. And then the question was, how are you going to ensure that the municipalities spend this grant? And then for the intended purposes, in order to also ensure that DCOC nationally is able to account for this money because they've given it to municipalities as a grant. That's the question that you didn't respond. The other question, I suppose, is the question that the Premier was supposed to respond to. but I believe you can share it amongst yourselves as MEC. I raised a question whether the province has a COVID-19 economic recovery plan and what are the details of such plan if it's there. And then I also asked, what is the commitment of the private sector towards the implementation of the economic recovery plan? And then also I asked this one, I think Honorable Tomuka will be able to respond to, is this economic recovery plan, if there's any, expressed in the IDPs of the municipalities? The other question that I should believe the Premier will have also responded to is with regard to this issue of KZN, in particular, Durban, a tourist attraction province. Is there a plan to monitor compliance of tourism establishment with COVID-19 protocols? Those were the unanswered questions on my part. I see Honorable Tomuka, you are eager to be the first one to respond. I can hand over to you. Then the others will respond on the other issues as raised by the two honorable members as well. Over to you, Honorable Tomuka. Honorable Tomuka, now it's your turn.
No, thank you, Chair. Not really that I'm eager to be the first to respond on the issues. I thought, Chair, you are calling my name to respond on the issues that you have raised. However, Chair, let's try by correcting the narrative that the Premier have run away from this engagement. He has been affected by the lockdown, unless Honorable Hossan have scientific proven that what the apology that was submitted was not correct, but it can be proven. The problem with the lockdown, you are told that you will come back at a certain time. Sometimes you are told it's 1 hour or 2 hours, and it might take more than that. But it differs from.
Never mind, sorry.
Am I still on podium, Chair, or is an order? Maybe let me, Chair, go straight to the issues that you directed to Copter. One, the issue of.
You have consistently said you have
I can't hear you, Chair.
Can you unmute your Honorable Tomuka? The microphone on mute. Honorable Tomuka, can you unmute your microphone?
I'm unmuted, Chair.
Yeah, yes, because your microphone was on mute. I'm asking you to unmute your microphone. And mute that microphone.
She's saying speak.
Unmute that microphone. Proceed.
No, it's fine, Chair. I'm sorry. My apology. I can't hear you very well, but I was trying to clarify the issue that honorable member is saying the Premier have run away. I think I will be failing to my responsibility to correct that. However, Chair.
Muted again.
Hi, Chair. We can hear him, Chairperson. I think the problem is on your side.
His microphone.
Chair, I was muted. I thought you were saying I must unmute. I unmuted. Now I don't know which one is which here. Must I speak or not speak? Okay, Chair, let me just go straight to the issues raised. You'll guide me.
Because I can hear him too.
Okay, Chair,
Can
let
hear
me go.
you.
Let me go just straight to the issues that you raised yourself. Chair, on the issue of MIG, I really don't know what to say now, Chair, because I really don't hear you and understand what we are saying. I don't want to be look like.
I think that is having a network problem because we can hear you. I can hear you, Shomuka, but it looks like she can't hear you. Chair, we can hear him.
Now, I'm not sure which, must I continue responding or must I wait for the chair? Because I don't want to be seen as if I'm disrespecting the chair on this platform.
I can hear him. I can hear him as well. Kalipi, I can hear him as well. I can hear him as well.
Okay, thank you, Chair. I think, Chair, let me just go straight to the issues that we have raised, Chair. Chair, on the issue of MIG, in terms of reprioritization of MIG, as was approved by Treasurer.
Can you proceed?
I'm proceeding, Chair. I'm saying, Chair, on the issue of reprioritization of MIG,
Muted now.
the National Treasurer approved transferring of money to municipalities in June, not in May. And National Treasurer, they've given 3 months to municipalities to spend that MIG. And Chair, I'm saying as the provincial government through Cooperative, we are monitoring the progress from that approved disaster grant. However, there are challenges because some of the grant was approved later and some of the request or business plan that was submitted by the municipalities to a national treasury or national government, it took time to be approved. However, it's not a chair, maybe I'm not sure about the Chair, I'm not sure what must I do now. I think, should I continue, Chair, or not? I
Continue, Baba. I'll call her. I'll call him, Honorable.
Now, thank you, Honorable Kalipi, taking over now. I think honorable members were trying to say, as a provincial government through Cooperative, we have systems in place to monitor the expenditure of MIG from the it's not true that the expenditure to date is 17%. So, Chair was saying we can provide a detailed report from all municipalities, those that they receive disaster grants, because there are other municipalities that they did not receive the MIG representation because of the business plan that they submitted, Chair. But it's not correct that the expenditure to date is 17%. But we can provide that detailed report to the Secretariat, Chair. Then it will come to you and the portfolio so that will prove that the expenditure is more than the percentages that is presented, Chair. Chair, you are correct. There is a provincial economic recovery plan that was presented in the economic cluster in the provincial economic cluster, which stipulated how are we going to have how are we going to recover in terms of the economy as a province, which include municipalities. And I can confirm, Chair, I'm not sure. It's unfortunately that when the Premier presented, we're not aware that we need to provide a detailed recovery plan, but we can also provide that provincially, KwaZulu-Natal provincially recovery plan about which will also include the municipalities. That's what I'm saying. If one needed, if this meeting request us to provide the details, we can do so, Chair. But even on the presentation itself, when the Premier, I think on slide, I'm not, but on in the presentation that was made by the Premier, there was a subtopic that saying COVID-19 response intervention recovery plan on local government economic sector recovery. If the colleagues they can check that, is stipulated, Chair, in that slide on our KZN economic recovery plan and how are we going to deal with in terms of clothing and textile and informal economy, health and innovative and ICT and different discipline or sectors. It is, Chair, on the slide or on the presentation that was presented. It is part of that slide. The problem is not detailed. We thought through the Premier, it was correct that we don't provide a detailed report, because if the Premier were going to present a more detailed, let me say not details, a more detailed report, it was going to be more than even 200 pages. Because if you can present an economic recovery plan alone, it might take maybe 90 pages or 90 or 100 pages as was presented in the economic cluster HM. The number, we have cited number of discipline, as I've indicated: manufacturing, ICT, health innovation, informal economy, agriculture, and so forth. If colleagues can go to slide 42, is where KZN recovery plan is recorded. I think, Chair, those are the issues that you wanted me to respond to it. But we can, outside this meeting, provide a detailed report that will respond on the issues. If this response is not sufficient, we can provide a written report which is detailed, and not that we're going to formulate it. It is there. It's just for us to send to the committee. Thank you very much.
Honorable Chairperson.
Can I start? Oh. Chair, I suppose
thank you so much. Hand over to
Ms. Mshengwe.
oh yes, Honorable Ms.
Thanks, Chair. Chair, I just want to first start by.
I'm not going to allow ladies first. The ladies first.
Oh, ladies
yes,
first.
Chairperson, ladies first.
Okay.
Can I come in, Chair?
It already started. I know.
Kushutu Shomuga is a lady, therefore.
Allow MEC Musengu to
Just
come back from Women's Month. Allow MEC Musengu to finish.
Okay, Chair, it's fine.
Viva,
Viva
Chair.
Tengu, can you proceed?
Thanks so much, Chair. Chair, let me first join.
Tengu,
Yes, Chair. Can you hear me?
can you proceed?
Yes, I'm proceeding, Chair. Chair, let me first start by joining MEC Hlomuga in dismissing the allegations that the Premier ran away as spurious.
Where was the Premier? Tell us, then we will know whether there was load shedding there. Tell us
Premier,
where was he?
I will not give you the details of where is the Premier. I will not.
Yes, I can hear you. Sure.
But we must dismiss with contempt as spurious the allegations that he ran away.
Where was he? Tell me, where was he?
The Premier of the province is known, like all of us, not to be scared of any debate.
But where was he?
Debates are based.
Tell me where he was. Then I will know you're telling the truth.
Even if debates are based on hogwash, we give ourselves time to engage because we're not scared of engaging on any matter. So the allegations that he ran away are really spurious and they must be understood as such. One honorable member here indicated that he could not open his video because of load shedding. And it is known, Chair, that load shedding does affect the network.
But he never
ran away. I was in the Provincial Executive Committee, and at my place, there was no electricity. I got cut. I did not run away from the Provincial Executive Committee. So, Chair, to turn this meeting, this important meeting, into a political mudslinging is quite unfortunate, and I don't think we should allow ourselves to descend to that level. Chair, there's an issue, Chair, as raised by Honorable Mkhalipi, and I think let me properly contextualize it. That for us, we were not. Okay, let me put it like this. For us, a parent and a guardian must exercise same responsibility. We acknowledge and understand the situation of a child, as explained by Honorable Mkhalipi. But equally, we need to face realities that a parent and a guardian should be able to exercise same level of responsibility towards the children. Because if it had happened that the child is given access to the school, she gets infected or she infects others, then again the responsibility will have been placed at the doorsteps of the teachers. The question would have been, why have you allowed that child to be in school without a mask and all of those things? So without really turning it into some kind of a discourse, that unfortunate incident, which we condemned, and really believe that it should not have happened if we're living in a normal society. But we wanted to contextualize that even the neighbors were irresponsible in letting the child to go to school without a mask. I am a parent, and I must exercise the parental responsibilities to whoever is under my roof, whether he's my child, my uncle's child, or whoever is under my guidance. I have that legal and moral responsibility to ensure that I exercise parental responsibilities, as it were. So that is what I wanted to contextualize, Chair, so that we are not in different positions with Honorable Mkhalipi. We just wanted to make that point because we are also observing, as I said earlier on, that there is some reckless behavior that is happening across the province. Outside that unfortunate incident, learners continue to come to school without masks. And who is to be blamed in that instance? Because the department has provided masks for learners, but they continue to come to school without masks. And if we don't become firm in pronouncing the responsibilities of the parents and calling them also to take responsibility and be accountable for their actions, will not be able to really properly manage this situation, because it calls for all of us to join hands in defeating this pandemic. Thank you so much.
Chair, may I come in? Konyeni?
Yes, proceed.
Thank you very much, Honorable Chairperson. I just wanted to indicate that yesterday at eThekwini, electricity came back at 8:45. So it is not always true that it will come back exactly at a certain hour. So we humbly apologize on behalf of our Premier. He is a leader who never runs away from difficult situations. If he was connected, he would have responded to all questions that have been posed. So we apologize on his behalf, Honorable Chairperson. Chair, just to respond to what Honorable Mkhaliphi has said, yes, she may come to my office at any given point. It is true that the former HOD for the Department of Human Settlements was Miss April Green, but I had forgotten that, and I had thought that maybe she was referring to Mr. April Green, who is employed in the office of the mayor of eThekwini Metro. We will be dealing with the issue raised. Indeed, we are trying by all means to deal with the issues pertaining to Brooks Farm. It is true that it's a very old project, but we are about to complete our interventions there, Honorable Chairperson. So we will never run away from assisting our people because that is what we are here for, to intervene in our people's difficult situations. So we will be working together. I am ready to convene a meeting as soon as possible. And as she has already indicated that she does have my contact number, she may do that. She may indicate when she is available, and I will ensure that we meet and resolve issues pertaining to that Brooks Farm. I wish to reiterate what Comrade Hlomuga has indicated here, that indeed in the province of KwaZulu-Natal, we have developed the Provincial Economic Recovery Plan, and we have identified sectors of the economy that will assist us with regards to stimulation of our economy. I might not mention the entire list of those sectors, but we are working together with KZN Economic Council, whereby your labor is represented, the business sector is represented, the NGO sector is represented, and all stakeholders that have to do with the stimulation of the economy are also represented. So we are very focused. It has already been presented to the Executive Council and adopted there. We are in the process now of developing implementation strategies so that our people may also benefit from the economy of our province. And we are very radical, Honorable Chairperson, with regards to ensuring that those who have not been benefiting from the economic spin-offs that present themselves in the province of KwaZulu-Natal are now benefiting. There are sectors that we have identified, Honorable Chairperson, and our people will be benefiting very soon. Thank you very much, Honorable Chairperson, and we really appreciate this opportunity of interacting with you. Thank you, Chair.
Honorable, thank you, MEC Nkonyini. Honorable MEC Similane.
Chairperson, thank you very much for the opportunity and the questions raised by the members. I think I also want to align myself with the issues raised by MEC Mshengu and MEC Hlomuga in particular in relation to the absence of the Premier. And Chairperson indicate that in fact, if the honorable member can actually go through this very same gadget, he will realize that at some point, I myself got disconnected on the system and had to reconnect again. And I'm here because I was able to get to a platform where I could get network. So it's very unfortunate that he wants to bring here his own understanding of what he thinks our Premier should be acting as. By the way, had the Premier not been willing to respond, he would not have been here in the first place, because he would have just sent all of us as we are here. But I also think, Chairperson, it's not honorable for an honorable member to come and accuse the province of KwaZulu-Natal as the most corrupt province. His own prejudices brings them into a portfolio committee as facts, when in essence he is actually making assumptions. Chairperson, I don't think that is in order, and I don't think that is how we need to be able to engage with each other when we actually want to make sure that the lives of our people are being improved. If the honorable member has an issue that he wants to raise with the province of KwaZulu-Natal, I'm sure there are correct platforms, but he should actually bring facts. When you say you call the province as the most corrupt in South Africa, that's a very serious allegation, Chairperson. And I don't think it's an allegation as a province we want to take lying down, because it's actually not correct. Chair, let me just indicate to Honorable Mkhaliphi that I am really I'm listening to her cries about the unavailability of the HOD, and I will take the matter up with the HOD. However, I will avail my contact details, Chairperson. Honorable Mkhaliphi can contact me anytime. I'm not sure how I will do that, whether I do it through you, Chairperson, I don't mind. And then Honorable Mkhaliphi can be in touch with me. I will also provide the contact details of the PLO in the Department of Health, so that when she can't get hold of me, she can get hold of him, because we actually look forward to working with honorable members who have an interest of developing the lives of our people. We look forward to working with honorable members who actually want to bring a change in the lives of the people, and not just make assumptions and present them here as facts. So I appreciate the work that is being done by Honorable Mkhaliphi, and I'm willing to work with him. Chair, the issue she is raising, Honorable Mkhaliphi, in relation to staffing in Eddington, in fact, is a challenge that we are faced with, not just in that particular facility, but in the majority of our facilities in the province. We have had a challenge in the past few years that are relating to that, Chairperson. And that is why when you were asking me about our legacy project, one of the things I indicated and said COVID has assisted us with was ensuring that we at least are able to employ some of the staff that we need, or that we needed, and was going to be able to assist in our facilities. So yes, we do have a challenge in that facility, Chair, but it's not the only facility where we are understaffed, purely on the basis that we don't have enough funds as a department and as a province in particular when it comes to that, and we've not been able to employ all the categories of staff that we need. However, we are working on a program with the Office of the Premier and the Premier in particular on how best can we address the particular issue. On the issue of racism, the complaint against racism, Chair, I will follow up with the Office of the HOD. I was under the impression that the matter was addressed after Honorable Mkhaliphi met with the head of department. But if it has not, I do make a commitment, Chair, that I will respond. Sorry, I will speak to the HOD and follow up in the matter, and we do actually have to finalize the matter. Chairperson, Honorable Hussein, if he had listened to me when I was speaking, he would not have been making assumptions about what I'm saying. What I said was that the service provider was not providing the services to the Department of Health that they are providing to in other companies. Now, if you are listening and you are listening with an intention of always trying to come up with something negative, you then find the statements that Honorable Hussein makes or is making in this particular meeting. If he had listened to me, Chair, he would have heard what I was saying. And what he's saying is not what I said. And it's very unfortunate that he's going to come here and twist what we are saying and make them sound the way that he wants them to. If he wants to come and play politics with the people's lives, that is him, Chair, that's going to do that. I'm not going to be party to that. But I must also indicate, Chair, that it's actually lies. It's lies that Eddington Hospital was refurbished a few years ago.
Point of order. Speaker, point of order.
Chairperson.
Yes, yes. I'm here. Can you hear me?
Yes, Speaker of Chairperson. Who do you recognize? Me or Keza, Chair?
Yes, yes.
You Chairperson. Thanks, Honorable.
I seem to be battling to have network. Can I hand over to Honorable Hadebe to take over?
Thank you, Chair.
Hadebe. Honorable Hadebe.
We can hear you, Chair.
Can you hear me now?
Yes.
Oh, is the time difference? Is it okay now?
Yes, Chair.
Okay, proceed. What is the point order of order about?
Thank you, Chairperson. Chairperson, the MEC is, can I say, attacking the Honourable Member Hussein. I just want to find out, Chairperson, if this is being allowed. He's a member of this committee. He had a perspective. He gave a perspective. And now it seems like every MEC that responds to him directly. He's a member of this committee, and I think he must be protected.
Chairperson.
Who's calling the chairperson? Honorable Hadebe?
Yes, I think that members of the committee, as we said before, cease to be political parties in the committee, and they do oversight work of the committee on the basis of them being members of the committee. And I think that they reserve the right, a constitutional right, to have a perspective, and that right being protected by the chairperson, and that, as it may, whether you disagree or not, the chairperson is then to ensure that that member is not attacked on a personal basis, because you know very well that we have issues that emanate from our people on the ground, issues that of public interest, issues of research, as researched on our own as members of the portfolio. And I don't think when we raise issues here, we raise issues on a personal basis to attack a particular, and I do not think that we have to be defensive of our provinces or municipalities. We just have to answer questions. Thank you, Chair.
Chair. Who's calling the chair again now?
It's Hussein also, Chair.
And MEC Mshengu.
Okay. You'll come in, all of you. Let me hear all of you. Honorable Hussein, Honorable Mshengu, I'll hear all of you. It's my duty to hear all of you. It's when you make arguments. Also, I will give you all the opportunity to talk to each other. At the end of the day, as long as we're all mindful here, it's about the people that we are dealing with. Then let me hear Honorable Hussein first. Maybe I'll respond to the other two speakers in relation to whether Honorable Hussein was being attacked or not. I'll respond to that as well, having been a chairperson and I was a referee on this matters. Okay, yeah. Can I give you Honorable Hussein?
Chair, thank you very much. May I just say that I have not once mentioned the name of any political party. So if the MEC see it as a political attack, I'm sorry that they do. But I'm not surprised, Chair, because they're not used to difficult questions. Not long ago, the Premier...
I don't think that's an order. Can I be allowed to respond?
MEC, I'll give you an opportunity to respond. Don't worry. I'm a fair chairperson here, and I know all of you have got the right to respond to whatever is said. I will allow you to respond. And I won't speak on behalf of any of you because here I'm a referee. I will allow you. I know you all have the capacity to take each other head on. Please, can we give the honorable member an opportunity to talk? I've already noted Honorable Mshengu will be followed by you, Honorable Similan. Let's allow Honorable Hussein to speak. Then Honorable Mshengu will follow. Honorable Similani will follow. Then I'll deal with this matter at the later stage. Okay, proceed, Honorable Hussein.
Yeah, Chair. In the very beginning, when the Premier finished his address, I made the point and I recognize the fact that there has been good work being done in many areas in the province. I said that. The MECs kept quiet. So when you say good things, they keep quiet. When you speak honestly and you talk about the bad things, then they all get hot under the collar. That's how it works here in KZN. They don't like you must say bad things about them. They want you to say good things.
Robert, can you mute your microphone, Honorable Robert, please? Sorry, Honorable Hussein. Pleading with Honorable Robert to mute his microphone. Okay, proceed.
So when you criticize them, they don't like it. You see all of them, how excited they get over one thing. They are not used to getting it. Even the Premier, he went on ENCA, they asked him one difficult question, they lose his cool. These are supposed to be politicians, mature politicians, and then they all lose their cool. Let me come to this issue about the load shedding story, Chair, and why I'm saying what I am saying. I want to ask all of these MECs who come to the defense of the Premier, tell us where exactly was the Premier when he was addressing us? Was he in Pietermaritzburg? Was he in his office? Was he in his house? Tell us the location, you should know. And I promise you, none of you will tell me. Do you know why? Because you know. We will find out the location and we will find out whether that location had load shedding or not. And if I am wrong, I will apologize to you and to the Premier.
But we don't know even your location. We don't know even your location.
Yeah, you don't know because you don't want to be
you can't ask the location.
Order, Chair, order.
Yes, Chair. We can't accept that. We really can't accept it.
Lomuka, please. We've started on a very good note. We are ending this meeting. My humble plea with you, colleagues, you will have an opportunity to respond. Don't interject the member. I'll give you an opportunity. I've noted you. You still come back on these matters. Please, let's respect the decorum of this house. Continue your code, please. Please, colleagues. Mshengu, mute your microphone. You are going to come after Honorable Hussein, followed by Similane, followed by Tlomuka. We address this matter. I'm here. Honorable Hussein, can you finish up?
Yeah, Chair, I will finish up, and I don't want to make it more difficult than it is already, but just simply to say to the MECs, if you believe that I am wrong, tell us where the Premier was. The Premier can't behave like he's running a courier company. He comes and deliver a package here and run away. And he was afraid to deal with the Zandile Gomede issue. If you think I'm wrong, then maybe one of you, I challenge you to deal with it. Give us an answer. Why have you taken the most corrupt mayor and put her in the most corrupt government in KZN? It's wrong. You owe the country an explanation, and you can't run away from it. If the Premier wants to run away from it, then maybe you must answer for him. Let's see which one of you are going to answer. Thank you very much.
Honorable
No, thanks, Chair.
Then Tomuka on that order. You will respond to these issues as raised. And yeah, talk to us.
No,
address. Sure.
No, thank you, Chair. We'll always refuse to be abused, Chair. And it's an abuse that an honorable member will have audacity to make spurious allegations. And when he's challenged on those allegations, he pleads attack. And that's why we're saying we'll refuse to be abused. We came here to this committee to account on the agenda, on the issues as raised on the agenda. And Chair, we have been very honorable in responding to questions, particularly to those from those honorable members who are really showing willingness to be objective on matters. Honorable Hussein
launched a personal attack to the Premier. Even now, he continues to do so. And therefore, when we launch a concomitant responses, they are pleading that they are being attacked. So, Chair, it is not true. We will not keep quiet when a scurrilous allegation that we are the most corrupt province is made, because that intentionally is meant to say we who are presiding over the government are corrupt. And Hussein has no proof of any of that corruption. And to be expected to keep quiet will be a dereliction of duty. We are not the most corrupt province. We are not scared of any debates. That is why we're even here at this hour debating. He accuses us of getting hot under the collar when it's him who calls an order when we are responding. We never called an order when he was attacking the Premier, when he was attacking the province of KZN, because we knew we can equally respond. So it's him who actually is getting hot under the collar and is calling for your protection when he actually started to base his arguments on the figment of imagination. And Chair, with all due respect to your committee and all honorable members, let's treat each other with respect and objectivity, but will not allow ourselves as a province also to be abused. Thank you so much.
Chairperson.
Allow the others. You will come after the other three. There were heads that I've noted.
Thank you, Chair.
For you. Yes. As Milane, you were still to answer your questions.
Yeah, Chair, thank you very much.
Let's deal with Lomuka first.
Okay.
Lomuka first. Lomuka?
Yes, Honorable Chair. Chair, I think I responded to most of the questions, but I think we are called honorable because of, there's a reason that we are called honorable, because our behavior must be honorable. That's why, Chair, I think my colleague, Honorable Mshengo, is correct that we must try by all means to abuse ourselves, because even ourselves, we can't abuse honorable members. On the issue that Chair is raised, I think it was important that we must diffuse the narrative that our leader, Honorable Prima, have run away. We are not going to keep quiet when we are attacked in the meeting and as if that narrative is correct. And we have never asked anyone their location, because we don't know why. What's the reason behind to ask a location? Because a location is a secret thing. But the issue of network is South African, actually it's a global issue. We can explain ourselves where we are. But on the issues that we have been asked to respond, Chair, we have responded. And I want to say we're not a corrupt province, but if there are allegations, we are allowed honorable members to go to police station and open a case for those corrupt activities that we are told that we are corrupt as a province or even as individual. So we're not going to, Chair, to keep quiet. I'm sorry if we have interrupted a member, but we're not going to keep quiet if we are insulted in this august house, because we are respecting this house, because we came here. Now the time is 5 to 11, and we're still awake to listen to the members and respond to the questions that relate to what the province is doing in relation to COVID-19. I think, Chair, it's important that we must to that. Thank you very much.
You made your point. Honorable Smilane?
Chairperson, thank you very much. Chair, when we were all elected, we were elected as members of the legislature in the province. You, the members of the committee, were elected as members of the National Assembly. Now, the fact that we are in a province and some members are in the National Assembly does not mean we are subhuman. And it means, Chairperson, all of us, because all of us are called honorable members, we must all be treated with respect. So when we are accused, Chairperson, when we are attacked at a personal level, because Honorable Hussein actually did that, And no one said anything in the committee when he was attacking us. We have a right to respond for ourselves because we're not protected. But Chairperson, Honorable Hussein said, when I raised an issue, he said what I was saying in relation to Eddington is crazy. He said I'm crazy in this meeting. And none of the members came to my defense. None of the members said it was not honorable what you were saying. So if members don't defend me, Chair, it means I must defend myself. Now, when Honorable Hussein responds, he says, Eddington Hospital was refurbished a few years ago. It is a lie. And there's no way around that. It is a lie. And that is what I need to say, because he is putting it in front of the committee as a fact when it is not. Chairperson, Honorable Hussein says, I'm crazy for even thinking about moving a hospital or together with the province away from an area where this hospital, in terms of services, in terms of renovations, cost the province of KwaZulu-Natal more than 300 million a year on refurbishments. It cost the province of KwaZulu-Natal more than 350 million a year. With that money, we could have built a new hospital. If it's crazy, Chairperson, to want to save money for the province of KwaZulu-Natal, then it means I am crazy. But in this meeting, I was called crazy and no one defended me. So if members, Honorable Chair, are going to be personal in dealing with the reports, they must then expect personal responses. You can't be personal and then think we are going to pet you. You can't be personal when you are dealing with us and think we are going to treat you like a teddy bear. No. If you fight, we fight back, because that is what you've given us. But I must say, Chairperson, that the majority of the members have treated us with respect, which is why we have responded and responded in the same fashion. And Chair, we are willing to work with all the members that are willing to work with us. Ngiyabonga, Slan.
Did you respond to all your questions that were directed to you?
I did.
Honorable Colonel Ved, I've given you an opportunity to talk on this matter, and to delay this matter further, not assisting us, especially when we are deviating from what we were supposed to do. Allow me to speak as a chairperson. Initially, I allowed you, all of you, to steam on each other, and then understanding that you are all honorable members of parliament, honorable members of the legislature. If you have seen, I've never defended anyone, because it's not my responsibility to defend anyone in a meeting. I'm expected to be impartial throughout and chair the meeting. But wherein then the others, you say something to others, they too have a right to reply on what you are saying. And I think that's what makes the debates to be so exciting and encouraging, because then a matter was put on to the colleagues from KZN that the Premier has run away from this meeting. And it was dependent on the 5 collective members of the executive who jointly worked with the Premier to say no. The mere fact that the Premier managed to come in here, and it's a fact, colleagues, that this is the second Premier who has appeared before us. The others have tendered apologies, and then under load shedding, like Mam Kiza as well, she wanted to raise issues, she have sent issues, she couldn't talk to us because of load shedding. So that balance of probabilities to say, I don't think the Premier will have just come here, not speaking on his defense, but that's why I allowed you to steam each other. But at the end of the day, what we do, whenever we do our things, we talk on matters. I should think, Honorable Smilane, we need to still maintain the decorum of the House and remain collegial as we deal with matters. That's why I allowed all of you to steam on each other. But then, definitely, when somebody feels that the other member didn't speak to him correctly, that member has got a right to respond. That's why I have since allowed to do that. Like the colleagues, I should think they were trying to indicate why their political principle has not been here. That's why I didn't even see any reason why I should protect either Honorable Hussein or them, to protect you from each other. Because my understanding is that you are all honorable members of the legislature and honorable members of the parliament, and you know the decorum that you must give to a sitting like this. Hence, I allowed all of you to steam on each other. To me, it shouldn't be personal. It's a debate. It was a political debate. The pity all of you are politicians. That's why hence you had to respond the way you responded to each other. But that doesn't make us deviate from what we've been doing thus far. From where I'm sitting as a chairperson, as a referee, I believe all our questions have been adequately responded to. And then if there are areas where we are not happy, colleagues, you know what to do. We're still going to deliberate as a committee in a way of finding recommendations. It will be another situation because in my case where I felt the questions were supposed to be answered by the Premier, MEC Nkonyeni and MEC Tomuka managed to answer those questions. To say then it was in that spirit that the Premier got disconnected, then that's the issue. But also, you won't even have to discourage what is Honorable Hussein's thinking on the matter. That's why I had to say that I allowed him also to continually interject because maybe by then when he was doing that, he was feeling also that his issues are not adequately responded to. So this should not create any enmity with different roles of responsibility that we are playing. And I must say, this is how it's unfortunately it's happening as we are about to close the meeting. And then there has been this like at the end of the day, all of us, we are honorable members of the legislature, honorable members of parliament. And that's why I allowed all of you to steam on each other. So that even tomorrow, then at least out of this exercise, we could have all then established the rules of engagement moving forward. Then if I was to take any side, then I would be unfair as chairperson. So that's it, then I allow the situation to the way. But then I think everybody has said the record straight. Honorable Hussein believed that the Premier just decided, didn't know why the MEC says our Premier left because of load shedding, then he couldn't reconnect, which is also a possibility and it's possible as well. You get disconnected. It has happened amongst most of us. Kalibi will give us a classical example. In the morning, you wanted to connect, you couldn't connect, but it happens. So, and this is not our first engagement as a committee with the province. We're still going to engage with this province. And then out of today's lessons, I think when we reconvene, when we meet again, Muga is still going to come. Then I think we shouldn't disrupt what was a very fruitful and to then end it on this note. Given all the parties to vent, and then out of that, I think there are life lessons learned. We say when we talk to each other as colleagues, that collegiality must always reign so that then we don't have issues of this nature happening. It's one of its kind. Some people will say, I don't envy you, chairperson, but that's what I was confronted with tonight. And then I should think I need to adjourn this meeting on this note.
Just before you adjourn, Chair.
Premier, there's been an executive to say, this is one Premier and to come in account will allow the Premier to do that, then this matter gets adjourned. What is the intervention all about, Honorable Fondervan?
Chairperson, my original point of order that I was raised was because the MEC Similane said that the Honourable Hussein is not honourable because he's not acting honourable. If that is what you're saying, then I want to ask her to give clarity or to withdraw. Please, Chair.
What's the point of order, Honorable Conover? I'm battling to hear that one.
Chairperson, the MEC Similane said that the Honourable Hussein is not honourable because he's not acting honourable. If what you just said is true and all House members are honourable, then she must either give clarity or she must withdraw.
Honorable Similane, did you say that Honorable Hussein is not honourable? I didn't hear that one.
No, Chair, I asked if it was honorable to call me crazy in a meeting. I asked a question.
I didn't hear you saying Mr. Honorable Hussein is not honorable. I didn't hear that.
No, I did not. I asked if it was honorable for him to call me that.
I never call her crazy. I said what she suggested is crazy.
So you say now. So can we end this meeting on this high note? I call it high note.
Thank you, Chair.
At least each and every one of you has managed to steam on each other. That's very healthy for a debate. Myself being a referee, I think I enjoyed the debate as it was unfolding. And then what I picked up is that you are all leaders at your own rights. So that's my message. You want to say something, Honorable Similan?
Yeah, yes, Chair. No, not about your summary, Chair. I promised Honorable Mkhaliphi my phone number, Chair. Can I give it to you? I'll send it to you. Then you can pass it to her.
And yeah, all of me, you know where to find it. And some of us were far away from all of you here.
Okay.
Don't be jealous, Chair. Take the phone number of the MS.
Fine. We'll get it.
Thanks.
We'll get it. Colleagues, let's end this meeting a very peaceful manner. We're still going to engage the province. Honorable Shomuka, Honorable Similane, Honorable Nkonyeni, whom did I miss? We're still going to engage this committee, as you have heard, the colleagues who are the lead department, a committee that does oversight on the disaster management. You know that. Secondly, we're the lead committee that deals with cooperative governance. Then yes, actually people with money what you want. And then the meeting gets adjourned. Enjoy your evening and let it be a good night. Colleagues, we are meeting again tomorrow after the sitting. Good night.
Good night, Chair. Good night.
Good
Thank you.
Thank you.
Thank you, Chair.
Chairperson. Thank you.